Avocados.
Good morning, everybody. It is 10 minutes
that
past 8 o'clock right now, and it is Tuesday, and we have a Democrat, we have a Republican at the desk, which means it is time for Party Scoopers.
Woohoo! So I was just trying to go through the paper to see what we should be talking about today. Oh, here we go. So we're closing the southern border, possibly.
Who needs it?
We're down by Mount Air. Okay.
And we're finding a replacement from Obamacare, it sounds like. Republicans are working on that, right, Craig? Is that what's going on?
Yeah, it's the first time.
We're in like year
12.
Okay.
Okay. All
Perfect.
Right, time to change
Actually,
it
But
up.
ten.
now,
Passed in 2009. So 10 years, the Republicans have promised a replacement for Obamacare.
A better system.
But now it's going to happen.
Well, not only is it not going to happen,
Oh.
they still can't even give you like the three things they're going to do. Like there is nothing. This is like the great fantasy. They said we're going to repeal and replace for 8 years.
Right. Well, that
And
was
then
really
they-
good
then they
poll-tested language.
Then they couldn't. Then they couldn't even repeal it. Then
Right.
then they tried to take just parts of it. Like this is just a complete debacle and a disaster on the part of the Republicans because they literally have nothing to offer.
So this is just a PR campaign?
Absolutely. Yeah. I mean, what are they
Substance behind this?
Maybe they could privatize it like they're doing in the state with Medicaid. That's working out pretty good.
Look, I mean, so Obamacare doesn't work, but and Republicans don't necessarily have a plan, which I agree with, and it's a problem. I always chuckled at this repeal and replace because I think if you actually had an honest survey of members of Congress, most of them Republicans wouldn't want to replace it. They think it's horrible. And so, I mean, they're fundamentally opposed to government-run health care. So repeal and replace is counter to that.
Well, and the great irony, of course, is that Obamacare is built on private insurance. So they're opposed to government-run health care, but they're also opposed to a plan that is based on private insurance. So that's why they can't replace it with anything, because they're opposed to everything.
Well, and as we see, we in Iowa, we have these managed care groups that come in, and Jeff and I were talking about it before, and it's like, yeah, I told him it kind of reminds me of like, and this is sad, like people in their cable TV. I mean, it's like, well, I'm with Dish Network until it gets really expensive, and then I have a dispute with them, and then I'm going to be with, I'll go to Mediacom, or I'll go here, or I'll go to, Dish Network, or now I'm cutting the cord and I'm just streaming everything. I mean, and it's disruptive. And it's, every time my parents come, they don't know how to run my television set. My dad's freaked out. Like, well, I just want to watch TV.
And that's the biggest
problem.
problem
And I think
of all.
people just really want health care. And the problem is that with all this change and all these things in flux, it's confusing to people.
Yeah, but much like you just mentioned here with getting some media entertainment, would it be advantageous to be able to switch around like that?
Well, I believe that people should have choice in their healthcare plans and be able to decide. But for decades we've been mandating different things. Every state's mandating different things into the healthcare plans. This is before Obamacare. And then what happens? The cost goes up and up and up and up and up, and people can't afford it. Democrats just want to, hey, let's just have the government, basically a blank check. We'll figure it out. And we'll, have to increase revenue elsewhere, higher taxes, and that doesn't necessarily work. And so, back in 1999, I worked for Steve Forbes, and he was a great guy, and the healthcare debate was going on then. And one of the things he said on the campaign trail a lot was, we don't have a healthcare crisis in America. Healthcare in America worked. It might not be ideal, but I think all this tinkering that we've done over the last 15 years has just made it worse. I mean, there's so much you don't know what you got, and people are confused by it. It needs to be simplified more than anything, in my opinion, and there has to be certainty in there where people aren't going, opening the paper up every day and it's like, oh, hey, I guess I'm losing my healthcare provider. What's that mean? That has to be scary.
Okay, so I'm glad you brought that up because that is a hot topic this morning here locally in our state. So can you guys break that down and what that means?
Right.
Basically, another option is
so
gone.
basically, the state of Iowa was in negotiations with United Healthcare, MCO that was existing in the state and working, and it covered, I think, 70% of 412,000 Iowans who are on Medicaid.
Okay.
And those negotiations didn't go well. and United Healthcare wanted more money, wanted more things, and the state wouldn't budge. And so now United Healthcare announces, hey, we're leaving, and which is fine. There's other managed care organizations that'll come in, and these people will have to move over to, and thankfully there's other options. There was one time not too long ago we only had one, I think, in the state, and so there's other options for people to go to, but it is disruptive and it does create all this uncertainty, and and again, how much certainty do we have in the next managed care organization to come in here and serve Iowans and not have all these disputes? Every year they come to Republicans like this privatized program because it's a line item on a budget. This is what we're spending for it. But every year they come back and say, look, we're short. And to make us whole, we need another, it's millions and millions of dollars every year. Right. So it's not that simple. And so it's really frustrating, but it's a huge problem.
Here's the problem. I mean, the whole idea of going from what we had that was working to what we have now, which is a complete disaster. We started with 3 managed care companies. We lost one 2 years ago. We're losing one now. It's not just losing a company. Like, the people who are most vulnerable rely every single day on their right. interaction with the company, for meds, for procedures, for life-saving care, and they need approval for that life-saving care. And so to switch from the state to these private entities was a big transition for a lot of families. And then when these companies have a dispute with the state and they leave, then they have to transition again. Well, 412,000 people don't get to choose whether they have DirecTV or Mediacom in this healthcare debate. They're told, your provider's gone, we're going to give you a new one. Like, there's no choice in that.
How much of a lag time is
well, we don't know, because the governor's office isn't telling us anything about how this transition's going to work.
This is a situation where one has to be in place before one leaves.
Absolutely.
And those are, I think people are guaranteed that there won't be a disruption of coverage.
Right.
But they have to get used
to
it.
But it's hugely disruptive.
It's very disruptive to what they know. I mean, my dad just had foot surgery. He's sitting in a recliner in eastern Iowa, has to be off it for 12 weeks. And so, yeah, I mean, it's tough for him. And like, my parents are with it and active and all that stuff. But just going through a surgery is complicated, and all the bills and all the stuff and all the doctor's appointments. And these people are going through and having to live, people who are on this depend on it, like Jeff was mentioning. And so any disruption just adds to the stress, and then the uncertainty of, well, is it going to be covered the same way? Is everything going to come when it needs to come,
right.
and all of that? So it is a problem.
All right. How are we going to
Is there any positive thing?
Don't go away.
So in healthcare, we don't know what's happening on a national front, and also
it's been this way for 12 years.
On the national front, though.
Hit closer to home now.
On the national front, here's what's going to happen. Like, we have Obamacare. The Republicans are unable to get rid of it. They talk about it, they like to use it for elections. They're unable to get rid of it. What really should happen is we should get some Democrats and Republicans together and fix some of the problems with Obamacare. It's not perfect, but eliminating discrimination for pre-existing conditions was a huge benefit of Obamacare. If you had a pre-existing condition, particularly if you're a child, and you were not allowed to get insurance because you had diabetes or something like that, that's gone. That's gone hopefully forever. We should keep that. We shouldn't throw that out. But let's keep the things that are working. Let's fix the things that are a problem. And move ahead that way, instead of this whole like crazy talk about we're going to get rid of the whole thing and start over. Like, it's insane.
Okay, so let's not get confused. If people are utilizing Obamacare right now, but they just won't be able to use the provider who's bailing on the state of Iowa.
So it's two different things.
Okay, that's what I was curious about.
Yeah,
okay.
So if you are in the state Medicaid program, if you qualify for state Medicaid and you are using United Healthcare, they have decided they're leaving the state of Iowa, and you're going to get forced into another company.
Okay.
We don't even know who that is. Could be Centene, could be another company. That's one issue. On the federal level, the Republicans are saying, oh, we're going to get rid of all of Obamacare, which is largely private employer-based insurance. It's a mix of things. They aren't going to repeal it because they tried for 2 years with a Republican House, a Republican Senate, and a Republican President. They couldn't get it done. They voted how many times? More than a dozen times to repeal it. They couldn't get it done. Trump is now saying he wants to try it again. I don't know why he's saying it, probably because he doesn't want to talk about the Mueller report.
Well, and Pelosi isn't going to, I mean, she ain't going to move the needle on this. She ain't going to help Republicans.
The House isn't going to agree to do this.
Right.
Absolutely.
Okay.
So,
All right.
Hey.
Exciting things happening in the world of politics. Hey, but at least we didn't talk about our Uncle Joe. You're watching Party Scoopers here on Iowa
I can
Live.
stick around. We
as
can come
do
back to that.
Valid point.
here on Iowa Live.